All right, so we're gonna take Pat through a test I call the Shin Box. I look at this often with people. Sometimes when people are having hip issues, I'll check it out to see and just rule in or out if it's the hip, and then see what tolerance they have to motion. So again, this is called the Shin Box. So you're gonna get down on the ground. Good. One leg's gonna go behind you, like this, and one in front of you. All right? So I kind of put him in this position here and then see how well he can sit up. So in this position, if you were breaking it down, this hip goes into what we call a little internal rotation, and this hip goes into external rotation. So if somebody has a really intense hip issue going on, you might see them kind of come off this side or side bend, or they wouldn't be able to come up and be straight up here. So Pat does a pretty good job here. So come on up. And what, do you feel anything with that?
It's tight through here.
So some tightness through there. So it's there. If this was relevant, then we would take him through some exercises to try to clear out that motion. And we'll talk about that a little bit more. But go ahead and switch ways. And then we look to see if this is symmetrical on both sides or not. How's that feel?
No problem.
No problem. So that right hip, we would kind of look into it a little bit more. When we look at this, why we would look at this, if somebody had difficulty with squats, or if somebody was having hip pain, I would look at this to see, is it the hip or is it the back? Or to see if they're intolerant to some of these motions. So on that right side, if he was intolerant to that right leg going, go ahead and you can switch, into that internal rotation, then we would start to sort that out and say, what could we do? And the first thing we would go to are some exercises to help to engage those muscles. When we squat, when we get to a certain point, we don't see it or feel it, but our hips do internally rotate. So if you can't tolerate that position, chances are when you're squatting, you might start to get some more anterior hip pain or not be able to go as deep. So I always tell people when they're squatting, if we can clear your hip box first or your shin box first, then you're going to be able to squat a lot better.